We've come to the Sure Start Children's Centre in Lydd, and we've got quite a few little babies crawling around, so you'll hear baby noise in the background. And my little girl Hannah is here too, but also sitting in front of me is Mum. What's your name?
Julie.
And tell me, which little baby is yours?
Amelia.
And how old is she?
She's 11 months.
Bless, and she's sitting up and she's looking absolutely beautiful in a lovely pink flowery dress. So there we go, and she's on the move. So when did you decide to breastfeed Amelia?
During the pregnancy, she is number 4. So obviously my first baby came along and immediately I knew I wanted to breastfeed, because you just I've seen people do it and thought, well, I'm going to want to experience it myself, but I didn't realise it was as difficult. I just thought it was easy. It looks easy, but I didn't find it easy. So however, out of all 4, I haven't managed to breastfeed all 4.
So why didn't you find it easy? Because it looks like this serene moment where you bond beautifully with your baby as of the Virgin Mother and Child type picture, isn't it? And it's just, why isn't it easy?
Well, since I've done breastfeeding peer support training, I've realised now that in the beginning it must have been attachment difficulties, because I felt initially in the first few sort of days of trying to breastfeed it felt fine, and then I just remember it just feeling sore and just thinking, what am I doing wrong? There isn't the support in the hospitals. The midwives are so busy doing other things that when you're sort of asking for help with breastfeeding, they haven't got time to show you, and I just thought you could just put them onto the breast and they suck and that's it. I didn't realise there was a specific way for them to latch on.
So when was that? So how old is your first, and what's his name or her name?
It's a girl, and she's called Alicia, and she's 8.5.
Right, okay, so that was 8.5 years ago, and you felt that you put her on and you were having difficulties once you left the hospital. So did you continue to feed her?
I used to just clench my toes and my teeth, count to 10, and then the pain just seemed to get easier, and I just carried on with that until I think she established breastfeeding, and then we managed for about 6 months. And then it just got to the point where she just I introduced formula milk, because she just didn't seem to sort of be thriving as much, so I introduced it to the bottle then.
I can remember the midwife explaining to me that you had to persist with this toe curling pain, and I thought, toe curling? This is more than toe curling pain. How long did that period last?
A while, because I do actually remember it always seemed worse at night as well, and it just seemed that as soon as you hear them cry in the night, I'd think, oh no, please, I just didn't want to latch. I used to dread it, and I used to think, oh, but I didn't want to give up either, because I knew the benefits, for her, so I carried on. But like I say, when my second child came along, my son, I was determined that I wasn't going to let it beat me, and I sort of fed him for about 15, 16 months, so he did really well.
Why did that one work differently? Why was that one for longer? Did you have more support around you, do you think?
I think I just sort of learnt from my previous experience, but I did try to introduce a bottle to him, just because, like I say, I found it difficult, but he just wouldn't suck from the bottle, so I had no choice. So I had to carry on, and even then, at a year old, he wouldn't take from a bottle, so I thought if he didn't take from me, he's not going to get anything, so...
Did you find that there was support around, or there has been more support around lately with Amelia now?
There's more support around now with Amelia, for definite. I mean, I don't really think... There was nowhere that I could have just turned up to a group like this centre and just asked somebody, and, definitely not. It was a case of you're in the hospital, you ask why you're in there, and if not, when you come home, when the midwife comes up to the 10-day, 10 days at your home, and that's it. If you don't get in then, you've lost your chance.
So what does this centre do then? What does the centre provide?
We have, I think we've got about 4 or 5 breastfeeding peer supporters. We advertise so people know that, when they're in the centre, they feel free to ask. We also have the midwives here every week on a Monday. They're here to ask. We also have health visitors every Tuesday afternoon, so if mums have got any issues, they can come in. Dads too, come in and ask on behalf of their partners. But we are here, and, even if you wanted to phone up and we're not in, they're quite happy to put you in contact with us, and we can sort of help to guide you.
So who can come along?
Anybody, even if it's mum or gran, because mum's a bit, a little bit embarrassed or concerned, you can send granny in or daddy in or anyone just to come in and just say, look, can you give me any tips? We've got leaflets and handouts, and I think we are in the process of trying to get some aids to help, sort of things like nipple shields and cream and things. We're in the process of trying to arrange those areas, but anyone can come in and ask.
And so where are you?
We're in Lydd, and that is on the Romney Marsh in Kent. Skinner's Road, yes. Yeah.
So you're talking about peer supporters, and you're a peer supporter now. What is a peer supporter?
A peer supporter is somebody who can guide you and assist you with any breastfeeding concerns. I've only just currently this year done the course. I'm still waiting actually for the certificate, so I'm not actually in the centre yet, sort of working. But basically, any concerns that anybody, a mum or, like I say, dad or anyone has got, they can come in and ask. We can even show you how attachments, what's wrong, what's right, how much milk supply you should have. We can tell you if you think it's going well, how long, and even come in when you're pregnant, from bumps, just to help mums learn a little bit more then, because I think sometimes the more you know in advance is easier than sometimes spur of the moment decision in hospital could be the wrong decision for you. So the earlier the better.
So tell me the advice that you give. What do you say to people? How do you tell them about the benefits of breastfeeding? What are those benefits?
The benefits are anything from it can prevent gastro problems. So obviously people using bottles, you can pick up more germs and bugs and things. It's supposed to prevent ear infections, just general health and well-being, your own bodily, your breast issues, things like that. This one's mine. It's just health and benefits for you and for mum, bonding,
Now this looks good, doesn't it? Amelia's going to try and talk, and she's reaching for the microphone too. So there we go. So that will be the added noise. Hello. So the benefits for baby are that you don't have the stomach upsets, you don't get bacterial infections from bottles, you get a general. You really have got a hold of that. You've got a strong grip, haven't you? You get
general health and well-being for mum and baby.
And so, what are the breast benefits for mum?
Well, helping for her to bond with baby can prevent things like postnatal depression, breast cancer, getting back to your body into shape, and it's cheaper and can sort of prevent any issues in the mouth. Obviously it's natural, isn't it? But it's more convenient. It is easier. But once you've established, but until you've established, and that's what we're here for, sort of to help guide you and with those little hiccups along the way.